Us
Thank you.
World Glaucoma Day,
Yes.
celebrated every year on the 12th of March.
Yeah.
Can you just give us a brief explanation, perhaps in layman term, as to glaucoma itself and how it affects the eye?
Okay. Glaucoma is an eye condition that affects the back of the eyes. Okay. It's an eye condition whereby there's what we call optic nerve at the back of the eyes, so which is caused by increased intraocular pressure, which is the eye pressure. Okay, so when this pressure is increased so much, it damages the optic nerve, and once this is done, it could cause irreversible blindness. First, it starts from the peripheral vision, the one we call the visual field. That is your side vision. That's why most people don't really notice it on time, because it doesn't start from the central vision, it starts by the side. Now, these visions start eating, then it gets to the center. But there is a damage at the back which is not common for you to see with your natural eyes. So the damage starts out gradually, and then before you know it, the eyes is taken. That's why we call glaucoma the thief of sight.
Mm-hmm. And how can one detect it early?
Okay, this is one of the reasons we are doing this awareness. Mm-hmm. Because normally glaucoma doesn't have any early signs and symptoms. Okay. And we advise people get regular eye tests, because if you are waiting for it to get to where you say, oh, my eyes are red, my eyes are paining, it might not get there. By the time it gets there, it's already late. We say by the time you are getting blurry vision from glaucoma, it's already late.
All right.
Yeah.
And how common is glaucoma in Namibia?
Oh, glaucoma is very common in Namibia, and we don't have so much information. Yeah, I've tested a lot of patients, and they're looking at the back of their eyes. I'm like, do you have any family history of glaucoma? Somebody will look at you. What's glaucoma? Mm. The knowledge is not there. And a lot of people that have it, they will say, oh, maybe they don't understand what it is. They don't even know what it is. And then they are reporting at a very late stage, where you are only managing what is left. Any damage caused by glaucoma cannot be reversed. The only management you are doing at that point is to manage what is left, not to reverse the damage that's been done.
Yeah, so it's irreversible.
Yeah, it's irreversible.
All right. Do we have perhaps different types of glaucomas?
Yeah, we have different types of glaucoma. We have angle closure glaucoma, we have open angle glaucoma, and we have congenital glaucoma. But the most common one is the open angle glaucoma, whereby in angle closure, sometimes, very rare, you notice that someone is having pain or reddish eyes, which is also common with other eye conditions. You wouldn't know which is it. But the open angle glaucoma is very common, especially in Namibia. It is very common in Namibia. It's also common in the world anyway, but so far so good. I've seen that open angle glaucoma is common in Namibia.
All right. And talk to us about the treatment process.
There are three treatments for glaucoma. The first one is the medication, the eye drop. There is laser treatment and there is surgery. Now, before you will be able to, you're not the one to decide which one you want. Is the type of glaucoma you have that the doctor will say, okay, this is what you need. It's not every glaucoma that needs surgery. That's one thing I need people to be aware of. Because people just say, oh, I have glaucoma, it's surgery. No, it's not all glaucoma that you need surgery. It's your specialist that will be able to say, okay, you have this type of glaucoma, and this is your treatment plan. And another thing, if you are being prescribed an eye drop, a mistake on another people make as well. They prescribe an eye drop for you. They give you a prescription, go to the pharmacy, buy an eye drop. Now, the eye drop finishes. You don't want to report back to say, okay, my eye drop has finished. Let's check if there is progress or not. You keep buying same. Okay, so you should be able to, if they are prescribed an eye drop, you shouldn't wait till you finish the eye drop, you go back again. No, you should follow your doctor's routine. So if you are giving an eye drop, it finishes, go back for a checkup. Let's see what is happening. Let's see, are there damages? Could we change? Because if this one isn't bringing down the pressure as we want, you can change the drop, but because you think this one is what you have been giving, you keep repeating the medication without going back to have a further check. So if you have been given any eye drop, please use and report to your doctor.
All right. Now, doctor, what causes glaucoma? We want to know, are there perhaps any lifestyle changes that people need to keep in mind in order just to avoid this, and can one also inherit it?
Yes. One of the major causes of glaucoma is inheritance.
Okay.
If you have parents or cousin or a family relative that have glaucoma, I usually tell my patients, once you have been diagnosed of glaucoma, inform your family. Have regular annual eye check. That is one of the, you have 5 to 6 times chances of developing glaucoma once someone in the family has been developed glaucoma. And then another one is there is a medication we call steroid. If you keep using it beyond, that's why I say don't just go. They give you medication, you have the doctor's prescription, you keep going to buy. Okay, if you use it beyond what you should use it, you are going to develop glaucoma and cataract at the same time. Okay, then the next one is if you have, there is what we call refractive error, like if you are nearsighted or farsighted and it's of higher degree. We try to monitor it, because if you leave it, you can also develop glaucoma, or something hit your eyes in the past and you didn't properly manage it, or you just you saw redness and after a while it has cleared, you just leave it.
Yeah.
It could cause you to develop glaucoma. Age is another thing. Once you are above 40, please have regular annual eye tests, because you can develop glaucoma at that stage.
And when we talk about regular annual eye test, how many times should one visit their doctor?
Okay, like I said initially, if you have family history of glaucoma, please, annually. Mm-hmm. If you don't have family history of glaucoma and you are above 40, still annually. But apart from these two things, or you have high refractive error, like you are nearsighted, but it's on the high side, you have to also check annually. But apart from all these ones, 2 years, it's okay.
All right. Doctor, interesting conversation we're having right here on glaucoma. We can go the whole day, talking about it. But since we are raising awareness, and today we are celebrating, not celebrating, but commemorating World Glaucoma Day, what are some of your words of advice to all of viewers this morning? And for those that are living with glaucoma right now, what are just some of your words of encouragement?
Okay, I would like to encourage everyone. Glaucoma doesn't look at your status. It doesn't look at whether you are a child or not. We still have congenital glaucoma. Make sure you get your eyes tested. That is the only way you will know that you have glaucoma. Get your eyes tested. And if you're a parent, you notice that you've been diagnosed of glaucoma, please do not keep it to yourself. Take it home. Tell them that you've been diagnosed of glaucoma, and they should have regular annual eye check. And when you are checking, please inform the doctor that is checking you that you have family history of glaucoma. It's very important. You don't just go, oh, they say annual eye check, you can't check. Please inform the doctor that is testing you, where I have family history of glaucoma, so that all the necessary tests that needs to be done will be done. And for those that are living with glaucoma, it's not the end of life. What you need to do, you can still see with your eyes till the end of your time, but make sure you stick to your doctor's routine. Do not manage it by yourself. It's not caused by poison. It's not a witchcraft. It's an eye condition, and it's being managed medically, and you can still use your eyes if detected early. The one that have already lost some parts, the one that is being managed, just stick to your doctor's routine so that you can also have the little you have to keep living.
All right. Yeah. Dr. Obina Jakes, thank you so much for joining us on Good Morning Namibia, for informing us and educating us on glaucoma.
Thank you.
All right. That was Dr. Joy Obina Jakes, who is an optometrist, joining us this morning, talking to us about glaucoma, seeing that today, the 12th of March, we are raising awareness on glaucoma. Today is World Glaucoma Day, and she's just encouraging us there, and also just, keep the faith, and don't forget to also visit your doctor and get those annual eye checkups. Don't go anywhere. Good Morning Namibia continues after this.